We will now hear from Professor Pijl, who is an internist, endocrinologist, and professor of diabetology at Leiden University. Thank you.
Thank you. It's an honor to be here. Let me tell you a story of a patient. Wim was diagnosed with type 2 diabetes in 2001 at the age of 40, and he was treated with metformin according to protocol. And metformin stabilized but not normalized his blood sugar levels. Over the years, his blood sugar increased, and he was prescribed another additional drug according to protocol as well. And he also got a drug to control his cholesterol and his blood pressure. Unfortunately, even that was not enough, up until the point in 2014 when he was prescribed insulin to further control his blood glucose levels, which had risen even more. So he started his insulin treatment in 2014. In 2015, he had gained 10 kilograms of weight. His blood sugar was still not in control. And at that point, his son came up to him and he said, "Listen, Dad, if you go on like this, you won't see me finish my studies." And Wim decided to totally change his approach of the disease. What he did was he cut out the sugar and starch from his diet to a minimum. He started eating unprocessed foods, and he increased his physical activity. This was Wim 1 year later. He lost 40 kilograms. He's without any drug. He stopped his insulin. He used 200 units of insulin before changing his lifestyle, which is a tremendous amount. So 1 year later, he lost 40 kilograms. He's without any drug. He stopped all his drugs, and his blood sugar level, his cholesterol, and his blood pressure are perfectly normal. Now, this story is meant to illustrate the power of lifestyle intervention in lifestyle-related disease, as opposed to drugs. The drugs simply didn't work. They work a little bit, but not enough. And with lifestyle, you can completely reverse this disorder. This is the number of people in the Netherlands per 1,000 with one or more chronic diseases. We live in a sick society. About 40% of people in between 40 and 50 years of age have one or more chronic diseases in the Netherlands. These are the associated costs, predicted to double in 2040 to 174 billion euros. And we know for a long time, many of these diseases, these chronic disorders, are lifestyle related. And we know for a long time, this is data from Science in 2002, that the vast majority of these disorders are preventable by lifestyle change. We can prevent people from becoming diabetic, and we can prevent people from getting a heart attack by changing lifestyle. And we know now more and more that we can treat, reverse, or even sometimes cure these disorders once they are there by changing lifestyle. So what I call for lifestyle, I call for lifestyle medicine as the treatment of these lifestyle-related diseases to take away the root cause of these diseases and not drugs. I thank you for your attention.
Thank you very much.